I'm Sico, and with me is Dr. Eileen Co-Sy. Doc, thank you so much for joining us. Si Doc is actually the director of the Co-Sy Fertility Clinic, which has been operating for almost 20 years now.
More than 20 years.
More than 20 years. And they're also opening the IVF Mabuhay Clinic at the end of the year. Congratulations, Doc. She's the Region 3 representative for the Philippine Society for Reproductive Medicine. Wow,
Thank you
Doc,
so much for having me.
so much that's happening in the industry, I understand, you know. Okay, so we'll go to your question, right? This one is really about the length of time a couple should wait. How long should they wait before they visit or consult a fertility specialist if they've been trying to conceive?
So that's a very good question. So in general, we want the couple to be having regular, unprotected intercourse for at least a year. Regular meaning they should have intercourse of at least 2 or 3 times a week. And then when we mean unprotected, of course, they're not using any form of contraception, whether it's the pill or barrier or even natural method. And then we say they should wait until a year, and that's because it's not actually an arbitrary thing to wait for a year, but that's based on statistics.
I see.
This means that within 1 year, about 85% of all couples should have already gotten pregnant.
I see.
This is based on the fact that the cycle fecundity rate, meaning yung chance of getting pregnant for one couple who has no problem, is only about 20%.
Oh.
So that within 6 months, so usually mga around 50-60% now would get pregnant, and then at the end of the year, around 85%. So this means that the chances of getting pregnant the next year or 2, on the second year or on the third year, is already very low. So this is in general for all couples, whether younger or older. But for the older couples specifically, we want to see them as early as possible. Usually within 6 months of getting married or having regular intercourse. But especially also even in younger couples where there are confounding morbidities, like those patients who already had surgery before, diagnosed with myoma, with endometriosis, and also one very common problem in the Philippines, if they don't have enough time to be together, but most especially in women who are more than 35 years old.
See, there are really so many factors to consider, even pala if you're normal.
Yes.
Right? Okay, wow. So much that you're learning. I'm learning about this also.
So, and the reason for the 35 years old is based on what we know about the ovarian reserve of a woman. And this is surprisingly not common knowledge.
This is because a woman has a finite number of eggs. Is that correct? I see.
This means that when a girl is born, a female baby is born, all of our eggs are already there, present in the ovaries. So as she ages and as she has menstruation, when she becomes an adolescent until she becomes menopausal, we know that about 100 eggs die within one cycle. So we don't want to wait until you're around 35 or more before you attempt a pregnancy.
Okay, thank you for that. Okay, we asked the audience for their questions, and this is the one that we chose for you. You actually mentioned something about time, and I think this comes from an OFW couple. So the question has a lot of background to it, so I'll share it first. I had endometriosis surgery and my husband varicocele, both already normal. I'm already recommended to a fertility specialist, and I'm taking folic, vitamin E, and calcium. Then I had an ultrasound last week where my myoma slightly increased in size. I was prescribed Provera for 10 days. Then if I have menses this month, I will take clomiphene again and ultrasound for follicle scan. Hope and pray this month, paalis na kasi si husband ko to work. Hope mabuo na. Is this enough to get pregnant?
So we're assuming that this girl who is asking this question is based in the Philippines and the husband is abroad,
Yes.
right? There are a lot of things actually lacking in this history. So the most important thing is I want to find out how old she is.
Oh.
She didn't mention, right?
Yes. Mhm.
So how old she is and how much time they've had together as a
Yeah.
couple. So they didn't say how many years they've been married and how many years they've been together in one home, cohabiting, meaning. And I want to find out if they've had enough chance to have regular intercourse within that period of time. And then, of course, yeah, she just told us about having endometriosis and having surgery, and she thinks that she's already cured from the endometriosis, when in fact, endometriosis is a chronic disease, meaning it doesn't mean that she already had the surgery that she doesn't have endometriosis anymore. That's why it's called pelvic endometriosis. So she has it until she dies, actually. So, in fact, having that surgery in itself, which she did not specify what type of surgery was done, whether she had an ovarian cyst on one ovary or
the other.
both sides, and she didn't mention whether the fallopian tubes were checked. Okay? If the tubes, both tubes are blocked, actually she has no more chance of getting pregnant with the usual way, by natural intercourse.
understand.
Because the only way for a woman to get pregnant without her tubes is only by test tube baby.
Oh, I
And now
see.
she's telling us that she also has myoma,
Uh-huh.
which was not taken out during the surgery.
So this is a very complicated
Yes,
case.
very complicated. So
I
she has to see an infertility specialist right away.
Yeah, it looks
to
like she's
increase her
recommended to a
chance.
fertility
Yes.
specialist,
Yes.
and it's a very challenging case. Yeah. So usually when they're that challenging, what happens? How do we help them?
Okay, so for this particular case, so if they haven't had enough chance to be together for a longer period of time, I would suggest, and I would check for patency of her fallopian tubes. Make sure that while she still does not have a new recurrent ovarian cyst, because of her pelvic endometriosis, is to give her controlled ovarian hyperstimulation, meaning we give her drugs, whether oral or injectable, to make her ovulate and then time the intercourse.
I see.
If after a few months, let's say 3 months, if the husband is able to stay for 3 months at a time, she's not pregnant yet, then we should progress into what we call assisted reproduction,
I see.
specifically in vitro fertilization.
So this is a very advanced case with different methods that need to be applied to it. Thank you so much. That's very helpful, Doc. I mean, sana natulungan natin yung couples na madaming tanong tungkol sa fertility. Like, this is a very complex case. Thank you so much for sharing. And thank you for joining Baby Goals, Doc. Thank you for watching. Stay tuned for more information so we can help you meet your baby goals.